Joining us in studio this half hour, she's a physician assistant and she's with Tripp Family Medicine right here in Twin Falls on Fillmore Street on the north side of the city. It's across from the post office in that part of town. I think most of you are familiar with the neighborhood. If you're doing any shopping or doing any mailing, many people have been to that neighborhood. And we want to point out Lauren Bostrom is with us until 9 o'clock this morning. Bill Colley with you too as well on News Radio 1310 KLIX and newsradio1310.com, but the temperature's dropped to 57. Not the coolest I've seen the last few weeks, but still it's somewhat of a relief from where we happen to have been. Welcome back.
Well, thanks for having me, Bill. So today I was hoping to talk a little bit about health insurance. It can be really complicated,
Tell me.
confusing, and frustrating for I think just about everybody.
The fact of the matter is, I had a medical pro in here a couple of days ago on the air, talking about she's a specialist, but we got to talking about insurance, and I think most people in medicine say we handle most insurances. That's immediately I think the biggest concern people have is because some providers work well with just about everybody, other providers not so much.
Yep. And so when you purchase a plan, you'll see different terminology. Some that specifically are looking for in-network providers. So those are providers that have contracted with that insurance plan to set rates so the insurance company can help control their cost. And so if you don't see a provider in network, a lot of times that means they're paying more out of pocket.
Right away, you wanted to mention that there are benefits and risks of not getting insured.
Yes.
Some very wealthy people don't do it simply because they pay out of pocket, but that's a very tiny percentage.
It's a small number. I think we're almost seeing that number increase because premiums have gone up so much, the cost of health insurance, and it can be a big dilemma for a lot of people. We have a penalty you pay for not being insured now. And for some people, that penalty, that cost outweighs the cost of them having an insurance plan. But it's also taking a gamble that you don't have something catastrophic happen or you end up in the hospital because those bills can easily get up to $50,000, $100,000 just to be in there if you don't have insurance.
Has that penalty changed? Have they dropped that, or is that still with us?
It's still there. I know there's talk of changing it, but as far as I've heard, it's still there. So I don't know what will happen down the road here, but
Now, you wanted to mention choosing the right plan to invest in, because I know that in many of the jobs I've worked, and here I pretty much had a choice of a 3 or 4 plans, and I was able to pick one that I thought was good for me. But I remember years ago, I got a long sheet from an insurer through my employer, a couple of pages long, and I just would check off various things that I wanted or I didn't want. But it left it up to me, at least some of the choice to me. And people do have those options very often.
yeah, there's often a lot of options. It's always helpful if you have a human resource person who's pretty comfortable with the plan and knowledgeable of it to ask questions. But if you're really confused, I really do encourage people find an insurance per person who does sell insurance, probably sells multiple plans, not just one, and who can help talk you through the process and talk you through pros and cons. But a lot of it is just understanding the terminology to choose the right plan.
I have a lot of friends who actually sell insurance. Most people do because it's such a big industry.
Hmm.
Oftentimes, they'll be more than willing, especially if you're willing to, maybe buy a product from them. They're willing to walk you through all of this.
Yes, and so that can be really helpful. But if that's not a direction you want to go, and also just having some background knowledge before you go can be incredibly helpful. So I wanted to talk through some of the terminology and in some ways also kind of from a provider's perspective, what that might mean for you too.
Sure. And the
Mhm.
terminology is probably where people, many times, that's the biggest hang up. It's like,
It is
how do I
because
understand this?
it's not common understanding the terminology they use. So kind of starting from the basics, there's something called a premium that people pay when you sign up for an insurance plan. This is the amount you've contracted to pay the insurance company every month, whether you're using healthcare insurances or not. So kind of like a car payment for health plans is the best way I
Yeah,
can describe that.
probably in the long run better than the car
Mhm.
payment for your health.
Right?
I got one of those today. I'm not kidding on that note. We've got about a minute before the break. Just another piece of terminology you might have beforehand.
So another one, this is a big one called the deductible, and this is the amount that you pay out of pocket before a lot
Sure.
of your benefits kick in, and I'll kind of go into that a little bit more after the break.
We do want to point out Tripp Family Medicine, as I mentioned, is on Fillmore Street in Twin Falls. It's on the north side of the city. It's across from the post office on that end of town. We have to clarify that because there are two big post offices in the city, and so we didn't. I think I was confusing people for a time, and very very quickly, for people who'd like to get in touch with the office, how do they do that?
So if you give us a call at 933-4400, call us up. We can make you an appointment. Stop by. We're by the post office, but kind of over by Gold's Gym's another good landmark too to find us.
Want to get back to Lauren Bostrom in just a moment, a physician assistant from Tripp Family Medicine. But first, a short break on News Radio 1310 KLIX, newsradio1310.com. Oh, the temperature just jumped to 60 very quickly, in fact, right in front of my eyes. I didn't notice because it's outside, obviously. Bill Colley with you, too, on News Radio 1310 KLIX. Lauren Bostrom joining us in studio. She is from Tripp Family Medicine here in Twin Falls. She's appearing with us today on News Radio 1310, KLIX and newsradio1310.com. Bill Colley with you as well. I'm here until 10 a.m. We're at 61. And do want to point out, telephone number if you've got a comment or question, 208-736-0300, 208-736-0300. And you had been mentioning deductibles on insurance plans.
Yes.
And then there's a couple of call them corollaries you wanted to bring up or things related to that. And it's how do people balance that out? Because sometimes people can make a choice on using it or not.
Yeah. So when it comes to health insurance, a lot of it is kind of similar to the stock market. How much risk are you wanting to take, and what factors do you know right now? So oftentimes when you start a job, if you get insurance through your employer, you often get offered kind of two options: a high deductible plan versus a low deductible plan. So again, deductible is the amount you will have to pay out of pocket before a lot of the insurance benefits kick in. So higher deductibles often mean that you're going to be paying a lot more out of pocket before you get those benefits. But your premiums, that's the amount that you're paying the insurance every month, are often lower. Whereas if you do a low deductible plan, that cost is a lot lower when to get to the point where your insurance kicks in, but your premiums, so what you're paying every month, is lower. So when you're looking at a plan, if you're someone who's young, healthy, hasn't had a lot of medical problems, often the high deductible plan is going to save you money because you're paying less every month for it. But if you're someone who has a lot of medical issues, you're diabetic per se, or you have COPD, you're going to have to see the doctor quite a bit. Your risk of being in the hospital is a lot higher. So you're probably going to want to go with a plan that has a lower deductible and a higher premium, and you'll often be saving yourself money in that direction.
A 28-year-old who eats right and exercises every day is probably thinking, their risk tolerance is going to be a little higher. But that doesn't mean that, you mentioned it's a little bit like buying stocks. You don't know always what's going to work or not. So you could be 28 and you could look very healthy and eat right, get exercise. But if you have a family history of cancer, for instance, you are taking a risk by maybe going with those higher deductibles and lower cost insurance policies.
Exactly. And you also want to look at lifestyle. So say you're a snowboarder who likes to do backflips down the ski hill, and there's a chance that you might hit your head, break something, that you might end up in the hospital. Maybe you do want to go with the lower deductible plan because I usually end up in the hospital once or twice a year. Then you're kind of looking at probably saving money going the low deductible route.
And then, you mentioned that there's some other things that you wanted to talk about related to this. Preventative services was one.
Yeah, so preventative services, it's interesting. Usually people we used to be able to kind of assume you have insurance, so once a year you can get kind of an annual exam to do kind of a good wellness check. This is not always the case nowadays, so you want to check with your plan before scheduling. Still, I'd say majority of plans do. And if they do, you're already paying for this. It's something that is somewhat considered free. There's not going to be any extra payment you're going to have to make to see the doctor once a year just to do kind of overall checkup to make sure things are doing well and make sure you're caught up on preventative screenings, including things like pap smears, colonoscopies, prostate screenings. Those are all included in preventative services if that's under your plan. And a lot of people are missing out on this benefit that they're somewhat paying for because they're paying that premium every month. And the tricky part, though, is understanding what a wellness visit is. So this is an area where...
And those are limited.
It's pretty limited in what you can talk about at that visit for it truly to be covered under a wellness. And as much this gets frustrating as a provider too for us, we didn't come up with the rules, but insurances do often look at our notes and make sure that what they're covering and paying for is what was discussed at the visit. So, according to insurances, a wellness visit means that there's no acute issues going on. We can't talk about any chronic issues like asthma, or say you go, oh, I've been having the sinus infection for 2 weeks. I figure I'd just wait because I had this appointment. If we start talking about that, then um, insurances go, no, that's not a wellness visit, or that's a wellness visit plus a sick visit. And so oftentimes patients may come in and expect to have all these issues covered under the wellness visit and get kind of frustrated when it's not covered under that. And it's confusing, I agree.
You want to talk a little bit about copayments too, as well. And I remember
Mhm.
when I was a kid, my parents had the old-fashioned indemnity plans. So you essentially you got catastrophic coverage, but when we went to the doctors, that was always out of pocket. That expense that they would
Mhm.
pay. And then years later, when I had a child and we were going, I had for a while an HMO, so there was always a copay, which seemed to be about the same amount, albeit in real dollar terms was likely less than what my parents were paying. But that also can be adjusted too, the level of your copay.
Yep. So when you're looking at plans, some will have what's called a copay, and often this is what you pay every time you seek a medical service. So for a lot of people, it'll often say on your card what your copayment is. So to come see a family practice provider, it might say your copayment is $20. And that $20, this is another part to look at when you're signing up for a plan, may or may not count towards your deductible. I believe most plans will count that towards your deductible out of pocket
If you
expenses.
have a big family, that's something you should really look at.
Yeah, because they can kind of see how quickly can we reach that deductible, so we get a lot of coverage from our insurance plan. For other people, there's a percentage and that they pay when they go see the doctor. So it might say you're going to pay 20% of what is billed, and the insurance is going to pay 80%. And sometimes that doesn't kick in until you reach your deductible.
I know one of the things you want to talk about is what happens when you meet your deductible. I have friends, and they make sure they go see the doctor or specialist early in the year
Hmm.
because they like to knock that deductible out of the way, and then the rest of the year they don't have to worry about it.
Yeah, so if you are someone who has a lot of health problems or a family that you're kind of expecting to have a lot of expenses in a year, the earlier in the year you go in, the quicker you're going to meet that deductible, which means that for a lot of times insurance will say, well, now if you go get an imaging study or surgery or in the hospital, we will cover 80%. You still might have to pay that 20%, which brings me to the next thing to check when you're looking at insurance plans, which is your maximum out of pocket. So this is the maximum amount of money you will have to spend of your own dollars before the insurance starts to cover things 100%. So if
And that can be different between major medical and just doctor's visits too.
yeah, so it can be specified on the insurance plan, but say for example your deductible is $3,000, but your maximum out of pocket is 6,000. So if you haven't seen the doctor and you ended up in the hospital and you have a $15,000 bill, you're still going to be paying about $6,000 of that before the insurance really kicks in.
So unless you have no other illness during the rest of the year, you're going to be paying the bulk of the cost.
Yep, if you have a big catastrophic event, that's
Not that you're hoping for a second illness
mhm.
so you can take advantage of
No, but not
that.
at all. But so I mean, that's where a lot of people can get kind of hung up with their insurance plans because they might have a high deductible that's maybe 6,000, and then their maximum out of pocket is 10,000. They go, I'm not sick enough. I'm never going to meet that. So they get really hesitant to go to the doctor's office because they're going to be paying 100% of their cost until they reach that point, which they're unlikely to meet unless they end up in the hospital, which we all hope they don't.
Even depending on the plan, though, when you reach the deductible, certain services still you may have to pay a percentage of.
Yep, and so you have a lot of them you have to check with your insurance of with what's covered. The deductible is kind of where you kind of hit that gap between maximum out of pocket and insurance benefits. So if you're in the hospital and you have met your deductible, they're going to have you discount what you're paying out of the pocket by 80%, but the rest of it they will cover after that. But it's kind of confusing after that point.
In some cases, it's probably if you know in advance you're going in for a procedure
Mhm.
to call the insurer, get all these questions answered so there's no surprises down the road.
Yep. So a lot of times, I mean, if you have something that you're planning, whether it be preventative services. You can double check with your insurance, an MRI, CT scan. If you get the codes, which your provider's office can help you determine what those are, because oftentimes they'll ask for something called a CPT code, which is the procedure code, and often a diagnostic code called an ICD-10 code.
I know it's not on your list, but I
Mhm.
have a question because I worked for an employer one time who was self-insured, and the employer was based in Connecticut. Most of us were working in Vermont for that employer, and if we'd been in Connecticut, we would have had a lot more covered too. We discovered later on. But what does self-insured mean?
Um, it has to do with the type of plan that they have. So a lot of times they're going to have something called an in-network provider, which is probably what you were looking at. The network providers were probably based in Connecticut,
Right.
and you're probably often seeking out-of-network providers that have kind of a higher cost that
Yeah,
they go with.
it would have been a 4 hour drive to get to the doctor's office in Connecticut. So most of us simply weren't doing that because the drive cost money. Uh, Talking about that in network and out of network, that's another confusing part. Maybe not for people who've had insurance for a long time,
Mhm.
but for younger people who are really brand new to this, they may
Yeah.
not quite understand what that means.
Yeah, and one thing I don't think I ever had any classes that taught me in college or undergrad about what is insurance and what to look for. So oftentimes we've been on our parents' insurance, and all of a sudden
Hmm.
you're on your own and you have your own insurance plan, and you kind of go, I haven't really had to care about this, and maybe you don't even put that much thought into insurance plans that you get through your employer because you just don't really understand it. And you haven't needed to see the doctor, so you're not too concerned. So in network means that you're looking at providers that have contracted with the insurance company and said, yes, we take this insurance, and we have agreed on set rates for certain types of visits. So the insurance company goes, yes, we're saving some money because we know that this provider is not going to be able to upcharge anything. Um, but the in-network also gives the patient the benefit of having lower cost of when they see the provider as well.
Now, you wanted to mention HMOs as well, the health maintenance
Hmm.
organizations. And I remember from my reading, these got created in the early 1970s, and they were exceptionally popular in the early 1990s. I don't know that they are as much popular now or nearly as popular, but they were almost an entirely different animal from traditional indemnity plans.
So I would say still probably most people, if they're doing private insurance, are probably still doing the health maintenance organization plan, the HMO plan. A big difference with this one is you usually have a primary care provider. So this is kind of where family practice comes in. That's kind of your point of care person. So in order to see a specialist, you usually have to see your primary care provider for a referral to be able to get that appointment in network covered. And also looking at who you're seeing in facilities and making sure they're covered by the insurance. There's another thing called preferred provider organization, um, which means that one
PPO for
benefit,
short, right? PPO.
PPO, yeah, which usually a big benefit that a lot of people see with this one is you don't have to go see your primary care provider to get that referral to the specialist. You can go, my knee's been hurting me, or I had a fall. I just want to go see the orthopedist and get yourself. You can just call their office and schedule that appointment.
A lot of people, depending on what age their kids are, when my daughter was young, it was an HMO. And then as we got older, we switched to a PPO. We found it worked better in that situation. And I think it really, depending on what stage of life you're in, and most people in their workplace get to make these choices on a yearly basis so they can review them and then come up with what they think works best at that time.
Yeah, and so it's this is where I mean having an insurance person kind of talk with you, and if you feel comfortable talking with them about any current health problems you have, that's where a lot of benefits can help you save money because these plans have gotten really expensive over time, and I think we all feel it, and we're all hearing that how much it's gone up just in the last couple of years just to have a health insurance.
I thought it was all going to be solved a decade ago. We've got one last thing you wanted to bring up. You've got a note here: preventative,
Mhm.
annual, acute
Mhm.
visits. The differences.
Yeah, and I touched base a little bit on this, but I think this is where as providers, we see a lot of patients frustrated as far as surprises and billing and whatnot because it's not very often that I'll be honest, just from what I see in the office, where patients come in for their wellness visit and they don't have other concerns that they want to be addressed. And we run into the dilemma of, do we do both the wellness visit and then also talk about your acute problems and chronic problems while you're here? But technically, um, based on laws by insurance, we'd have to bill that as both a wellness and an acute visit. If you're Medicare, this is different. We can't do, it's very confusing. Medicare has, you cannot do a wellness visit and talk about other problems. If we do, that's considered fraud. So um, it's really complicated. And with the Medicare insurance, which I know we have a lot of listeners who are on Medicare, they have a really unique annual wellness, which is not the typical kind of head to toe, listen to you, make sure everything sounds okay. It's actually a lot of paperwork and screening for things like dementia, fall risk, talking about advanced directives, and then making a plan to catch you up on any preventative services like colonoscopies that you might need.
Got a few seconds left. You also included a link to a website that might be helpful for people.
Yeah, it's kind of might be a little bit long, but this is where it kind of outlines a lot of good information for people who are just kind of looking at terminology and wanting a better understanding. So it's called www.healthcare.com, and it is /blog/health insurance 101 healthcare guide. But really, if you just overall look up healthcare terminology, choosing a plan that's right for me, there's a lot of good resources. I would just check that it's not affiliated with one insurance company. Make sure it's a
Yes.
generalized,
They're trying
non-biased
to
person, because
recruit you.
the things that are going to show up on the top are the people who are specific insurances that are trying to sell you something. So scroll down a little bit when you go look. The other big one for Medicare has a really good resource for people with Medicare, because there's a lot of supplement plans, also called there's the Medicare Advantage versus the supplement to consider too.
Well, we want to thank Lauren Bostrom from Tripp Family Medicine joining us on Better Health with Tripp Family Medicine this morning. Remember, life's too short not to feel good. We will see you in the pitching rotation sometime again in the next
I
few
don't
weeks.
know when that next time is, but thanks for having me. Again, 933-4400 for an
Sometimes
appointment.
she comes in as the pinch hitter, too. So we want to point out news is next. And we have a very special guest joining us, and he's joining us from the Intermountain Christian News Service. He is the White House correspondent, but he's here in Idaho, grew up, in fact, in Meridian. He'll be joining us in a few minutes. We're at 9 o'clock on News Radio 1310 KLIX.